And typically, the best candidate would be someone with what we call the androgenetic condition. And both men and women are subject to hair loss due to androgenetic condition. It happens, it could happen at any stage of our life. Some people can get it early in life, some people later in life. And what is really specific to androgenetic alopecia is miniaturization of hair follicles. So when we talk about hair loss, when people think it's shedding, so shedding could happen in certain situations like fluvial stress related hair loss, but the androgenetic alopecia or male or female pattern hair loss is due to miniaturized hair follicles. That's what happens. So it's a progressive miniaturization. Any other questions? How do you determine the direction of the implanted hair? Okay, very good question. Okay, so um, here we switch to a different method of hair restoration. We call it sharp implantation. So with sharp implantation, it allows us to achieve a perfect directionality during the insertion. And I will try to show some of the short video you can see at the screen in the back. This is, by the way, one of the presentation that I did a few months ago in the Dominican Republic, and to address the directionality here. So here's typical angles that require different areas of the scalp. So when we talk about the anterior part, we need to insert with the angles between 15 to 20 degrees. Right? Directions are also extremely important. Now, I hope you can see it in the back. So basically, you can see how the hair is directed forward, straight forward here, and here, this is the line right through the 44 angle. That's what we call 44 angle. And you can see how the angles get sort of like a Christmas tree pattern from here. Okay, and so very very important when I place the hair follicles, and everything has to kind of flow smoothly. Okay, you cannot put it in one direction, change it to a different. So when I go from this angle here and here, it has to flow smoothly. This is how natural hairline should be. This is what we use. It's called Sharpie bumpers. It's sort of like a little needle, and the hair follicle is loaded right into this direction.
We're open today at normal hours, and then we're going to be open on Mondays. So today we close at 5. The harvest? Yeah. The harvest. Mhm. Yeah, we usually ship it at the end of the day. Um, if that's right. So like you wouldn't be getting it today, but you would be shipping it today. Okay, sure. Uh, I mean, with the holidays coming up, I generally don't know. It would most likely it would probably be like a shopping. Yeah,
It restarts itself, sort of. Okay, it has what they call reperfusion injury, right? And and it's sort of a shocking condition for the hair itself. And as a result, it goes in the dormant phase or telogen phase, right? And each one of us has a different telogen length or telogen phase length. So this is how we're all different as far as how long does it take to resolve. So say if you don't see much by 6 months, it doesn't mean that you're not gonna see more by 9 or 12 months. Okay. Any other questions? What's the cost of the consultation to find out what can be done? Okay. So the cost is varies. So we in our practice, and obviously different doctors will have a different price schedule. Okay. So we can provide a free consultation with our hair restoration specialist. It is free. Okay, it is basically to answer most of the questions, to give advice. Consultation with the physician, we do charge. What do we charge? $150, and this takes about an hour overall. We do trichoscopy, microanalysis. Again, I'm a physician, so I will look for other causes of the hair loss. I will try to determine whether patient is a good candidate for hair restoration, what type of hair restoration, what medical therapy, and if necessary, we order labs. So it's basically like a visit to the doctor that will look for overall health status and see if there's anything else that we need to address. Okay, the next question, do you tattoo the hairline before the implant? Um, no, I do not tattoo the hairline. I draw the hairline first, and we do it the day before the procedure. So my patients, they can go home, they can show it to significant others, they can look more than one or two or multiple times in the mirror and make sure it's actually what they like, okay? Because again, there is my opinion and there is my patient's opinion. What is important is my patient. Again, here we put everyone at the center. And so the way we do it here, I like to see a patient the day before, design a hairline, the patient go back home, make sure that he or she likes it, comes back next morning when we do the procedure. If we need to adjust something, we do it on that day. I hope that answers the question. Okay, next question is, how much time approximately does the surgery takes from Evgeny? Okay, so it depends. Okay, here in Habitat Max, we don't work with technicians. So technicians do not do any surgical manipulation on our patients. I do the entire procedure from the beginning till the end. I do implant every single graft in my own hands. So, and obviously, the length of the procedure depends how many grafts we are planning to perform. 1,000 graft case will not take as long as 4,000 graft case. And so let's say the one of this what they call mega procedures, 4,000 graft case, can take up to from 7 a.m. until 5 p.m. Okay. Okay. 1,000 graft case we're usually done by 11 or by noon. Okay, hope it answers. Okay, let me check. This is Instagram here, right, on the left.
Mhm.
Hello. So yes, of hair. So I use. So what the method of hair restoration do you use? Um, so we here we do only FUE, follicular unit excision. Okay, the methods we include. We have pretty much every piece of technology that available now in the world. Okay, starting with robotic technology of RTAS, Neograft, Trivellini, or Mamba device. We have Harris, and we have WA by Dr. DeVro. Okay, so the beauty of having different technologies is that we can tailor it for every patient needs because everyone is different, and every device has pros and cons. Okay, here. Who is a good candidate for RTAS, hair restoration? Question from Casey. Okay, so yeah, as I mentioned, we do have multiple technology, cutting edge technology. One of the most sophisticated devices is RTAS. And RTAS is excellent choice because it does a lot what I have to do doing manual extraction. It takes pretty much away from me, and it is using very sophisticated technology, three different cameras. It calculates the angle of excision. It measures the force that the needle has to use to penetrate the skin and excise the graft. So I think it's excellent technology, and I'm a big proponent, and I use it frequently. So most of the patients, there are what they call the FDA um, um, criteria for using our test, and this is a Caucasian male with straight hair. However, you can use, as a physician, we can use devices what they call off-label, and I found that to be useful for people with curly hair, with darker skin, even on women. So, and of course, it has to be determined. The physician is in charge. Okay, and physician needs to determine what tool to use. And RTAS is an excellent, very precise robotic tool that we use frequently in hair restoration. Next one is what are mistakes some doctor make with hairline design and how do you ensure natural looking result? Well, this is a huge topic by itself. Okay, so it could be actually one of the topics for the live lecture or live question and answers, how to ensure the natural looking hairline. What is really important, okay, when you do research who is going to be your physician to perform the surgery, it's important to realize that you want to see someone who actually does the most of the procedure and actually present with the patient and has enough knowledge about what the hairline look like. So generally, the hairline after restoration, if I, as a hair transplant doctor who does it for a full time for living, so if I walk and see someone walking down the street that I had no idea who this person is, it's not going to be screaming, "Oh, he had a hairline somewhere, and here we go." Okay, so the hair might be thick in the hairline, but if it doesn't look natural, it's not a good result. Okay, so some of the principles, and I will go also let me show here, for example. I don't know if you can see. So this is a patient who had pretty limited hair loss um, previously, right? And you can see he lost some hair follicle over here. So the end result, I can hopefully zoom in a little bit more. No, can I?
Top.
Okay, yes, right here. Okay, so here's his final result. You can see if we look closer, right here, you can see how this hairline has to be irregular. Okay, it's not only irregular, so you can have this flowing macro irregularities. Additionally, it has to have the micro irregularities. Micro irregularities is little peaks. So what I use here, I create a map, and I'm going to show a little bit. I create a map using the trichoscopy to identify a finer hair, and the finer hair will be used to create this irregularity, or the other words, transition zone. Okay, if you see the straight hairline with a thick hair, just like it's been taken by, it's a lot of time it happens where doctors do not participate a lot in the surgery. So they give technician, okay, um, I need 2,000 grafts. So they harvest it from the occipital part of the head. They're all thick, and they put it as a straight line, and then it pretty much forever disfigures the patient. So you can see how important it is to use the proper caliber hair and creating this irregularity and sort of a see-through appearance in the beginning, right? in other in other words, I can show here in the back. Um, just a moment. So here we go. Here's when we talk about here's when we talk about micro irregularities. You can see how they look, right? And macro irregularities highlighted with the red dotted line. I don't know if it's visible. Is it visible?
Yeah, it's probably a little too far, but they get this idea.
Okay, perfect. And just to demonstrate some of the points here, we can see here's part of the presentation that I did a few months ago about properly identifying finer hair follicles. And you can see here's the map I created before the surgery. And right in the middle, sorry, I was covering my head, you can see the finer hair follicles identified in the green areas right here. A little bit thicker hair follicles identified in these areas, and the thickest are right here. And this is how we determine, because I present the entire procedure, so I can tell when I do the placement, I tell my assistants, okay, I need a finer hair follicles for the transition zone, and transition zone is outlined right here. So I take hair follicles from the created map, create this transitional see-through appearance. And then if I need to work in the dense zone right here, I will ask my assistant, okay, let's get a thicker caliber hair follicles, and we'll work on this defining look of the hairline. Okay, any other questions? Mm-hmm. Okay, how much approximately does this surgery take? So we answered about how long does it take. Okay, so do you do beard transplant and how does it go? Okay, very good question. So with beard become became pretty fashionable, and including me, you know, I've been shaving for probably 49 years of my life. Right? And recently I decided to grow a beard. It becomes a really important topic. It is possible to do the beard transplant. very important, again, beard transplant is not simple. It requires a lot of understanding how to place hair follicle, how to do the direction, how to do the angles, how to do the graft selection. Because it's very easy, just like any facial hair restoration, eyebrows, beard, you want to research who is qualified. Okay, don't trust just because they say I know that. Okay, you want to see the results, you want to see the work, and you want to see experience. So beard hair restoration is a great field because we typically we use hair from the back of the hair from the occipital part, and some men would like to see more. Some areas of the beard not growing, they would like to add there. Some have very scarce hair, and they want to add more density. So everything is doable, and usually the results are excellent because in the facial area we have one of the best vascularity, the best oxygen delivery. So anytime you plant somewhere when you have a good nurturing conditions, right? It's like having a good soil, right? It when it's done correctly, you can see absolutely fabulous results. Can you show an example of bad and good hairline? Okay, yeah. So I brought my lecture here, and I can show some examples of what I saw as surgeon in my practice. So, what are the unnatural hairlines? So, um, again, back to principle. What is a natural hairline? Natural hairline has to have a natural shape that will not look odd when we see that person. Okay, so here's some of the examples. See, here's the patient who had a hair restoration. I think one of the areas budget clinics, and you can see how hairline is straight here, right? It's not very. There's no variation um, in the transitional zone. The survival rate is pretty bad. You can see a lot of see-through areas. Too straight, also wrong angle, wrong direction of the hair follicle. Here's another example. When you have a poor survival rate, hairlines too straight, directions are completely off. Each hair is growing in its own direction. There is no this natural flow that's supposed to. Okay, this is another one. This is example. Yeah, poor survival rate. Hairline is too low. It's only 6.5 centimeter. You cannot go that low with the hairline. So sometimes patient requests to do it, but yes, it's not a good idea. Here's another hairline um, with pretty much everything is wrong. Like you can name what is right, nothing is right. There's poor survival rate is here, right? You have completely different angles everywhere. Uh, direction is off. Frontal angle is all the way to the side, so you cannot name anything right about this. So this is why it is so important to make sure that you pick the right place. And there are tons of excellent doctors. This is one of the topics of ISHRS, International Society of Hair Restoration Surgery, in the campaign we call the Fight the Fight. And it is all about making sure that our patients they get the best care possible. There's a lot of shady places now, and we're not going to name anybody, but you can do your own research, and this is very important to make sure that you get taken care of by a doctor, not by the gray market or someone with claiming to be something they're not. All right, so here's another example: a very poor survival rate, bad planning of the hairline, You can see how this hair transplant was done without considering future hair loss of the patient. Here's another patient with a bad pluggy appearance and odd shape and pretty much everything is wrong. But anything else? Do you take uh, patients out of state? Oh, and some of the examples of the good hairlines. Okay, this is what example of the dense zone, transitional zone, how they're supposed to look like. Here's another patient who had, and you can see his hairline looks, here's the same patient from a different angle. And um, you can see how the directionality is how it's supposed to be. It's irregular, right caliber of hair being used. Here's another patient. You can see how the hairline appears to be natural. So me, if I see that person walking down the street, I will not suspect he had a hair transplant. Here's another patient, before and after. So, okay. Do you take patient out of the state? Yes, we actually we see patient all over the world. Patient, we have patient traveling from Europe, from Middle East, a lot of some South America, Canada. Um, Again, the difference is that I think, okay, we are not a meal clinic. We don't work with numbers, okay. Some clinics in out of state countries, they can do 70 surgeries per day with having just one physician present on premises. So this is the concept that we completely against. So in our clinic, we have um, a room that our patient can fly in, they can stay on the second floor. We have a assigned unit. It's like a hotel room, and everything revolves around this patient. Okay, every staff, me, and so we're not working numbers. We try to get as provide as quality care as possible. Why did you switch to direct graft implantation? Very good question. Actually, direct graft implantation, it's sort of a name. Okay, what the proper name would be sharp implanters. So sharp. When I started the clinic 7 years ago, I did just like everybody else. I was always harvesting my own hair follicles, always from the beginning. But the implantation was done by a technician. Okay, and most of the time you can have 3 or 4 technicians who will implant hair, and it worked okay. The problem is you have 3 different people with 3 different skill sets, and honestly, there's going to be some variation in the results. So I always was bothered. Okay, why am I supposed to be dependent on skills of 3 different people to implant? So I was looking for a method to relieve all these concerns, and since 2019, for 4 years, we switched to sharp implanters. And sharp implanters work very different because um, with this method, I do every single graft implantation, and my assistants are loading these grafts. So we bypass the step of making sites, then training people. Sometimes it takes a year or so for a technician to attain good speed of placing, making sure there's no injury to graft anatomy and so on. So it was a bad decision. I'm now being able to be involved 100% with the surgery, and I love it. I stay with my patients from the beginning until the end, until we're done with this procedure. Um, any questions? How do you manage? Um, Next question from YouTube. How do you manage pain? Good topic. Um, one of the things I've been involved is in research on how to make sure that we get the least pain and the most comfortable patient experience during the procedure. So for the last few years, I've been using automatic injector devices. Do you have any video of how to use this to show? Um, and it's different other sets, tools to help you alleviate this pain. So bottom line from any procedure is it should not be painful. Okay. After the anesthesia administered correctly, there should be complete nerve blockade that will relieve any unwanted sensation during the surgery. Okay, so the question is how to deliver it in the most efficient way and the least uncomfortable way to our patient. So I've been using um, automatic, something that you see in the screen is called automatic injector device. The advantage of automatic injection is that we can use a much smaller caliber needle, and we can precisely regulate the pressure while the anesthetic being injected. We can use vibration devices as well to help to alleviate any, it kind of distracts with during the injection. And the study that I did, I was asking patients, okay, so here's a regular syringe, I'm injecting in one area, and the second injection I was performing using automatic device. So with a reduction of more than 50% of pain perception to only 2.3 versus I believe it was 6.4. So it does work well. And of course we prescribe mild pain killers and post-operatively it is the same way. Okay. How do you manage pain? What is the recovery like and any tips post-procedure care? So recovery varies, okay, and but typically it very mild. So there are some precautions that we ask our patient to follow, and precautions would be no heavy lifting, no contact sports such as skiing and karate or anything like that for at least 7 days, because we want to prevent any physical injury to the grafted area, right? Because until we have a good anchoring when we after the transplantation takes a few days before we start seeing the the skin the side repair mechanism being activated by our body. It takes a few days. So I asked for 7 days to refrain from swimming, contact sports, and usually after 7-10 days, depends on how we recover, we can return back to normal. After 3 days, we can start wearing a hat, and um, yeah, as time goes, it gets after I think 2 weeks or so, we can get to complete normal functioning. How can I schedule a consultation? So yeah, it's very easy. You can call us. You can go to website greenbackhair.com. send us a message, text message, anything, any methods that we'll get back with you and we can schedule a consultation. How long does the implant hair last? Will the procedure need to be repeated? These are excellent questions. Very, very good question, and actually I was waiting for that. Um, and I will try to, okay, let me just pull, where's my presentation? Okay, here we go. Okay. So, one of the main principles that we need to understand, okay, we are not, with any hair restoration procedure, there's no way going back in time because we have limited resources. And to give, to put things into perspective, here's the excellent um, idea. So, excellent visual aid to understand why. So you can see right here, this is the diagram that sort of represents what we used to have when we were 18 or 20 years old. So a typical male will have about 20,000 follicular units just on top of the head. We're talking about frontal, mid-scalp, and the crown area. So 20,000. So if we take everything we can from the donor area from the average person, we can only get about 7,000 follicular units, right? So it's only 1/3 of what it used to be. So determination whether we need another procedure or not is clear, okay? Hair loss is a progressive condition. It's a chronic condition, and it's very important to realize it's never going to stop. We can try to control with best medications, PRPs, Regenera. There's a lot of treatments, and it's important to look for something that clinically proven to work, not something you read off Facebook chats and anything like this, because there is a way to evaluate of any medical therapy being effective versus non-effective. Okay, so if somebody says, "Oh, I use rosemary oil and it helped me to regrow hair," this is not an evidence that's actually effective. Okay, so effective therapy will have proper studies where they evaluate what we call a double-blind method, whether this therapy working or not. Okay, so some medications is on the mainstream, it's finasteride, minoxidil. Okay, there are more emergent therapies, exosomes, PRP, Regenera. So all these are it's shown to be effective. Okay, so back to the question whether I need another transplant is most likely yes, because if there's more progression of the hair loss, it's likely that you'll need another transplant. If you are very compliant, you take everything what you're supposed to take, you can delay or even prevent a need for another hair transplant because, again, when we do the transplant and we replace, let's say, 2,000 grafts in the frontal area, right? These 2,000 grafts will likely last you a lifetime, but the hair that I had before the hair transplant, I don't know what's going to happen to this hair. It might be okay, or it might continue to be lost year after year. So this is, I hope it kind of puts things into perspective. Anything else? Okay, can you treat women hair loss? Absolutely, yes. And in with women, it is a little bit more complicated because women do not have um, the same, sometimes the same reasons for the hair loss. So the cause of the hair loss needs to be really investigated because we can see more incidents of autoimmune conditions, and sometimes they look just like female pattern hair hair loss, alopecia. So, what worst case scenario, if these conditions are not being recognized promptly by a qualified medical professional, again, this is very important to see a qualified medical doctor, especially if you're a female. A male, the same thing. Okay, we need to make sure there is no other underlying condition that is not a good choice for hair transplant. Women can have CCCA, cervical alopecia. They can have frontal fibrosing alopecia. They can have lichen planopilaris. There are a lot of conditions that needs to be recognized. Make sure there's nothing else going on. But if woman is a good candidate for hair restoration, absolutely yes. And we have good examples how it can be effectively treated with hair transplant. Some women not good candidates, and medical therapy would be a better choice. Depends what stage and what patient desires. Okay, next, is it possible to do a transplant for patient with alopecia? So from Lillian Nitris. So I hope you can hear. So yes, depends what type of alopecia. It is possible if you're. I hope you're referring to autoimmune alopecia. Yes, it is possible to do hair transplant, and we frequently do it. However, we need to diagnose and make sure we know what we're dealing with. So if we're dealing with frontal fibrosing alopecia or centrifugal cicatricial alopecia, once it's diagnosed and we can start the medical therapy and make sure it's well controlled after a certain period of time, and this varies among different doctors, so there's no consensus how much we need to wait after this alopecia is being controlled. I think it has to be at least 1 year. Some doctors will tell 2 years. We can definitely do the hair transplant and making sure that we continue on the medical therapy and treat any flare-ups promptly. Um, okay, any? Okay, here's. Okay, so here's something. Hi, Dr. Max. I'm Carla. Sorry to interrupt you live. I'm from Brazil. I'm talking to someone who is pretending to be you, and I suspected it was a scam. I came to you just to inform you they made. Okay, it's possible. We live in the world that it's very easy to pretend that someone is someone else, but I hope you can recognize my voice uh, and the look, and yeah, I'm definitely not talking to you at the same time. Um, Sorry, I just turned 50, so I really need to make a little effort to read this little letter. So, okay, is it possible to do a patient with LP? Next question from Nina. What about the hyperbaric treatment? I heard you suggested it before and after. What is it for? Can you provide more details? Yes, excellent question. So, one of my life passion, except my wife, was hyperbaric medicine. Okay, I've been a diver with Roberto for many years, and I was looking into hyperbaric medicine as one of the solution to many problems. Okay, and with waiting to open a new center, that was one of my things on the bucket list I needed to get. It was a hyperbaric chamber, and I want to get a real one. It was called the hospital grade chamber, that capable of administering 3 atmosphere oxygen treatment. So, in a nutshell, what is hyperbaric chamber? What is hyperbaric medicine? What is the treatment? So, it's been used since 50s or 60s as a treatment for non-healing wound ulcers, something that was used as sort of a last resort therapy um, for the conditions to stimulate regeneration. It was working excellent, right? And it's actually FDA approved for using in non-healing wounds because it does potentiate regenerative processes so people are able to heal. Why was not a first resort? Because it was expensive. Okay, these chambers are very expensive. It's expensive to run, and of course, when the insurance companies decide whether they cover something cheap versus something expensive, they go first choice to something cheaper. So over years, hyperbaric chambers become more popular and more affordable. And what it basically does, it saturates our every cell of our body with higher 500 times, I'm sorry, 500% more oxygen levels. And why I feel, and it happens because we breathe 100% oxygen mask at 2 atmosphere, which is equivalent to 33 feet underwater. There's no water there. It's basically the chamber that compresses the air, and the person, the patient, is inside this chamber. You can probably see it on my website. So there's so many articles, so many studies on PubMed showing how it could help with wound healing, with angiogenesis. Angiogenesis, that's the vascular recovery when the body creates new vessels, new vascularity, and it helps with that. It helps remove free radicals by increasing superoxide dismutase, this enzyme that remove free radicals from cells. There's a lot of usages. So I was looking for something to help, especially during hair transplant. And I used to send my patients to different facilities. The problem with that was that sometimes we couldn't get an appointment on the next day. Sometimes we had to wait for 2 days. And my idea was how to use this hyperbaric during surgery as a part of the surgery. So from now, we actually have this chamber. It takes the entire room now, but we do incorporate it with every surgery. So before we start, my patient go into the chamber for about an hour treatment. After the finish, on the same day, the surgery, the patient goes again to the hyperbaric chamber. And the good thing about it, that this oxygen that we consume during the treatment stays elevated in every cell, including scalp area, for 9 hours at least. And it was measured uh, with the devices that actually we have elevated oxygen levels. And it helps in theory, at least, okay, and practically me seeing the results, clear all this reperfusion injury. And reperfusion injury, what that means, when we take a live tissue and we put it in a petri dish, say it's a petri dish, we put it for 3 hours, right? This tissue is still a live tissue. It continues to function. It continues and it goes what they call the anaerobic cycle. That means that the tissue is live, right? Because it's our tissue. It continues to function, but there's no blood flow. There's no way to remove all these byproducts of metabolism, and they're all accumulated there. So when they place them back there, there's what they call a reperfusion injury. So one of the topics that probably still need to be investigated, but it did show that it did help with recovery of free flap grafts and other grafts when you work with the live tissue. So I'm a big proponent of using hyperbaric medicine as a part of the surgery. And it's, by the way, it's one of the approaches, is patient-centered care. Again, we do everything what's needed just for one person on that day of the procedure. Okay, are there any health conditions that you do not recommend to go for hair transplant? Generally, so there are absolutely contraindicated conditions. There are relative contraindication, and there are conditions that obviously okay. Okay, so I would say an absolute contraindication would be an active autoimmune alopecia, CCCA, lichen planopilaris, from fibrosis that's not under control. It has to be identified and make sure that we start medical therapy prior to considering hair transplant. There are conditions previous, for example, I would probably be reluctant to operate someone who had a transplant and on immunosuppressive therapy, for example. I mean, some conditions would be okay because immunocompromised people might not be the best choice. Again, and this is case by case. People with severe heart disease, CHF, coronary congestive heart failure, and this kind of things, COPD that they cannot breathe. So obviously, generalized condition that might affect the entire body function would not be a good choice. But again, most of the time it's case by case. We do thorough evaluation. So this is one of the differences, right? So when you travel somewhere to a clinic, right? You are there. You arrive to airport. They take you to the clinic, and you know they're gonna do the surgery. But what they don't do, they don't do proper medical evaluation. And sometimes we need to do lab work. Sometimes we need to do biopsy. Frequently, I do biopsy on patients to make sure we don't deal with autoimmune alopecias. And this is something you cannot. And again, let's say majority cases, it's okay. But you might be someone that do require further evaluation, and it cannot be missed. Okay. What time is it now? Okay, so I think we most of the questions. Is there any other question before? I think we've been streaming over an hour. All right. Okay, so it was our first live stream, and we'll make sure that we have more opportunities to go live and answer some questions. Um, our staff is excellent. You can call us with any questions. We'll be happy to answer. Um, and I hope you all enjoyed, and I hope you can join me next time. We'll make an announcement probably a week prior, and with some reminders. And I hope everyone has happy holidays. Uh, Coming Thanksgiving tomorrow. Okay. Watch what you eat. Right. That's important. So it was nice to be here, and hope to see you soon, everybody.